Welcome back, everyone, to Have More Babies. This is where we get into the practical stuff, the knowledge that really helps you day to day as parents. Today, we're tackling something super common, maybe a bit mysterious sometimes. Warts on kids.
Hmm.
Okay, so let's unpack this. We're going to walk through it all using an excellent article from Omega Pediatrics as our guide, really trying to demystify these little skin growths. And this matters because, wow, warts are common in childhood. They can make kids feel a bit insecure, or sometimes they're just plain uncomfortable. Understanding them really gives you, the parent, a bit more control.
Absolutely. And what I found really interesting in that Omega Pediatrics piece was not just the what, but the why. Like why some kids seem more prone, even if they're around the same stuff. It really brings the immune system into focus, which, might not be the first thing parents think about with warts. So yeah, this guide, it covers the causes, the types, treatments, even prevention. It's solid, evidence-based info, but like presented clearly, hopefully very valuable for parents looking for answers without getting bogged down.
Totally agree. That immune system angle is key. Okay, so let's start right at the beginning. What exactly are we talking about when we say warts? The article defines them pretty simply. Small, hard, benign growths on the skin. Benign is the important word there.
Right, and they pop up because of a virus, the human papillomavirus, or HPV. Now, I know hearing HPV can make some parents' ears prick up, thinking about other more serious health links.
Yeah, that's a common reaction.
It is. But the Omega Pediatrics article is really good about clarifying this. The HPV strains causing common warts, they're typically harmless, different from the ones linked to more serious conditions. It's a super important distinction. Helps ease a lot of worry. So while these warts can be annoying, persistent sometimes, they're generally not cancerous, and often they actually just go away on their own over time as the child's immunity kicks in.
Right, the body figures it out eventually. Though sometimes you do need to step in if they hang around or cause problems. Okay, so I admit, before reading this, I kind of thought, a wart is a wart. But the article breaks down different types. This was interesting.
Mm-hmm. It matters.
Yeah. So there are common warts. Those are the ones you often see on, like, fingers, back of the hands, rough little bumps.
Pretty standard, yeah.
Then there are plantar warts. These are the ones on the bottom of the feet. And the article specifically mentions these can be painful, like having a little rock in your shoe constantly. Sounds rough for an active kid.
Oh, definitely. Location really changes the game with symptoms. And besides those, there are flat warts. Smaller, smoother, flatter. You might see them on the face, arms, sometimes in little clusters.
Okay, flatter ones, different look.
Yep. And then filiform warts. These are kind of weird looking. Long, thin, almost thread-like, often pop up on the face, maybe near the eyes or mouth.
Wow, okay.
And one more the article covers, periungual warts. These guys hang out around or even under the fingernails or toenails. Can be a bit tricky there.
Huh. So knowing the type isn't just for, like, trivia. It actually helps figure out what to do.
Exactly. It influences the symptoms, like we said, with plantar warts being painful, and it can definitely guide the treatment approach.
So how does it guide treatment? Like, is it a totally different method for a foot wart versus one on the face?
It can be, yeah. Think about it. A plantar wart is under pressure all day from walking. It might need something a bit more intensive, maybe cryotherapy, that's the freezing method, or even laser to get deep enough. Whereas a flat wart on the face, the skin's more delicate there, you might start with a gentler topical treatment first. And those periungual ones near the nails need careful handling so you don't mess with the nail bed. So yeah, the type and location, super important for the doctor deciding the best plan.
Gotcha. Okay, that makes sense. So HPV causes them. There are different kinds.
Yeah.
But how do kids actually get them? They're always touching stuff, playing together.
Right. The article points to a few main ways. The biggest one is direct contact with the virus, usually skin to skin.
Like holding hands, sharing toys, that kind of thing.
Exactly. Or sharing a towel after swimming, maybe roughhousing. If there's a tiny cut or scrape, which, let's face it, kids always have, it's an easy entry point for the virus.
Okay. And then there are those places. The article mentioned public showers, pools, gyms. Why are those such hotspots?
Well, HPV likes warm, damp environments. Think pool decks, locker room floors, perfect breeding ground. Plus, lots of bare feet walking around. If someone with a plantar wart walks there, they can shed the virus onto the surface, and then the next person, your child maybe, picks it up.
Okay. Public pools suddenly seem less fun.
Well, it's just about being aware. And this connects back to that immune system point we mentioned earlier. HPV exposure is super common for kids. But whether a wart actually develops, that often depends on the child's individual immune response. Kids with immune systems that are still developing or maybe a bit weaker for some reason, they might be more likely to get warts. Their body just doesn't fight off the virus as effectively right away.
That explains why siblings might have different experiences even in the same house, same pool. Okay, so we know how they get there. What are the actual signs parents should look for? What makes you go, maybe that's a wart?
Well, the most obvious thing is just seeing the growth, right? A bump on the skin. But look closer. The texture is often a clue. Common warts especially feel rough, kind of like sandpaper.
Right, rough texture. And you mentioned pain for the plantar ones. Any other symptoms?
Discomfort is definitely key for those foot warts. It can really affect how a child walks or plays. As for color, they're often just flesh-colored, blending in a bit. But they can also be darker brownish, grayish sometimes. And occasionally you might see tiny black dots inside the wart. Those are just little clotted blood vessels, totally normal for warts.
Okay, so visible bump, rough texture, maybe pain depending on location, sometimes little black dots. That gives parents a good checklist.
Exactly. Those visible signs are your first alert, the thing that makes you think, okay, maybe we should get this checked out.
Right. So you see something suspicious. What's next? How does a doctor diagnose it? And what are the options for actually getting rid of them? Because parents usually want the, quickest, easiest, least painful fix for their kid.
Diagnosis is usually very straightforward. The article confirms this most of the time. A doctor can tell it's a wart just by looking at it. Visual inspection. They're pretty distinct looking. Tests are rarely needed. A biopsy might only happen if it looks really unusual, just to rule out anything else, but that's uncommon for typical warts.
Okay, so diagnosis is simple. What about treatment? The article listed quite a few options. Seems like topical treatments like salicylic acid are often step one.
Yeah, that's a very common starting point. Salicylic acid comes in liquids, gels, patches. You apply it regularly, and it basically works by peeling away the layers of the wart bit by bit. It's something you can often do at home.
We've used those badges before. Pretty easy. What if that doesn't work?
Then the next step might be cryotherapy. That's the freezing technique, usually done in the doctor's office with liquid nitrogen. It creates a blister under the wart, and hopefully the wart lifts off with the blistered skin as it heals.
Okay, freezing. Sounds a bit intense, but effective.
It often is, yeah. Can take a few sessions sometimes. For really stubborn warts or maybe larger ones, laser therapy is another option the article mentions. Uses a focused light beam to destroy the wart tissue. And then, kind of as a last resort, if nothing else works, there's surgical removal, basically cutting the wart out.
Wow, okay. Quite a range from patches to surgery.
Right.
So this brings up a big question. How do you know which one is right? Seems like a lot for a parent to decide.
And that's exactly why you need that professional assessment. It's not really for the parent to decide alone. What works best depends on the child, the type of wart, where it is, how long it's been there, lots of factors. The article makes a really important point here. This information is educational. It's not a replacement for seeing a doctor or a pediatric specialist. They're the ones who can properly diagnose it, look at your child's specific situation, and recommend the best treatment path, weighing, effectiveness against potential discomfort or side effects. They guide you through it.
Okay, crucial disclaimer. Always talk to the doc. So treatments are there if you need them. But what about avoiding them in the first place? Prevention. What can parents do?
Yeah, the proactive approach. The Omega Pediatrics Guide gives some really good practical tips. Number one is just good hygiene. Sounds basic, but regular hand washing with soap and water, good bathing habits. That helps wash away the virus before it gets a chance to settle in.
Makes sense. Keep things clean. What else?
Educating kids, and this can be tricky to try and avoid touching warts, their own, or warts on other kids.
Yeah. Hard not to poke at things when you're a kid.
Totally. So it needs gentle reminders, maybe explaining it as keeping skin healthy. And protective gear is big, especially for those high-risk places. The article stresses wearing flip-flops or water shoes around pools, in locker rooms, public showers. Just creating that physical barrier between their feet and potentially contaminated surfaces makes a real difference.
Simple steps, but probably quite effective if you make them habits.
Exactly. They can really reduce the chances of picking up the virus or spreading it if your child already has one.
Okay, so we've covered a lot. What warts are, the different kinds, how HPV spreads, what to look for, diagnosis, treatment options from salicylic acid up to surgery, and those key prevention tics like hygiene and footwear. So pulling it all together, what's the big takeaway for parents listening right now?
I think the main message is that, yeah, warts can be annoying, they can be stubborn, but they're manageable. Having this kind of knowledge, understanding they're common, knowing the basics of prevention and treatment, it turns it from this, unknown worry into something you can actually handle. You're equipped.
Right. It takes away some of the mystery and maybe some of the stress. And thinking beyond just the skin growth itself, even small things like warts can impact how a kid feels, right?
Right.
Their confidence.
Absolutely. Especially if they're visible or if they're painful, like those plantar warts.
Huh.
Kids can get self-conscious. So being able to address it calmly, knowing what it is and what your options are, that helps your child feel supported and less anxious about it, too. It's not just about the wart. It's about their overall well-being.
That's a great point. It's about navigating these common childhood things with confidence.
Mhm. So maybe something for you listening to think about after this. How does understanding these common childhood issues, even ones that seem minor like warts, actually help you feel more prepared, more calm on this whole parenting journey? It's about building that toolkit of knowledge so you can handle these little bumps, sometimes literal bumps, along the way.
Perfectly put. That empowerment through knowledge is what we're all about here on Have More Babies.
Thank you so much for walking through this with us. And for everyone listening, if you want to dive deeper, read the full article we discussed, or find tons more resources on pediatric care, definitely head over to omegapediatrics.com. They have a fantastic website full of reliable information. Again, that's omegapediatrics.com. And hey, if you found this useful today, please do give this video a like, subscribe to the channel so you don't miss future discussions, and maybe share this video with another parent who might find it helpful too.
Yeah, thanks for tuning in, everyone. Keep empowering yourselves with that knowledge. It makes a difference. Goodbye for now.
See you next time.